Good afternoon, everybody. It's a tremendous pleasure to be participating in this group session. So sexual health is affected, honestly, for every cancer patient, every cancer survivor. So you're not unique in wanting to have information and in thinking that it's important. In fact, there are general problems, sexual problems in the general population after the age of 40, and there is a group at the University of Chicago that studies sexual behavior throughout the life cycle. And what they find is that in a population of men and women over 40, as many as 80% of men and 70% of women report that they have sexual difficulties. So these difficulties might be for many women due to menopause and health conditions, and for men it's largely due to health conditions and aging. Men are mostly concerned about erectile dysfunction, and women complain about difficulty with lubrication and lack of sexual interest. So as I said, this is not a unique issue. However, most men and women don't seek help for sexual problems. Largely, this is due to the fact that people are uncomfortable, both patients and physicians and nurses and social workers and psychologists. Everybody's pretty uncomfortable with the topic. And sometimes patients don't realize that they are entitled to ask about this in the context of that chronic condition. So that's kind of in the general population. So this is a nice diagram that shows how cancer can lead to problems. So if you look up at the top, you will see that cancer treatment produces all kinds of body changes, sort of like Sean was talking about. It can change hormones, it can change body integrity, it can decrease blood flow, which is really necessary for sexual function, and some people lose body parts. Some people even have either lack of sensation or pain, and many cancer treatments cause fatigue. So if somebody's got these kinds of physiological changes, you can bet that that person is going to have feelings about it. And sometimes people feel depressed or anxious. They worry that they can't have control over their body anymore and start feeling like life is going to be much harder in this way. And again, you can bet that if a person's feeling worried about their functioning, that their partner's going to notice it. And there's going to be some tension in the relationship, because even when people try to support each other and be kind to each other, there is this anxiety about what the future holds. And, at best, people communicate about it and find resources and figure it out. And at worst, people start avoiding talking about it and start feeling less connected. In the United States, we're growing increasingly diverse, so it's important when we do evaluations about sexual health to consider people's social and cultural affiliations. For example, in prostate cancer, one of the rehabilitation activities is masturbation. Well, we know that in the Catholic faith that may not be an acceptable practice, and it's also not acceptable sometimes in the Muslim faith. And social and cultural attitudes towards sexuality have a great deal of influence on how people can deal with sexual recovery. So as you can see here, it's a really much bigger picture than what happens to the body. It starts with the body, and then it kind of penetrates into people's psychology, into their relationships, and even into just a quick review of the human sexual response, first described by Masters and Johnson and then amended by Helen Singer Kaplan. So sexual response starts with desire, which is largely a mental process where we begin to think about sex, we begin to cue to sexual stimuli, have sexual fantasies, and that brings about arousal, and we begin to feel that our heart beats a little bit faster, we start feeling flushed, this breathing gets a little bit faster, and in the brain, the neurotransmitter dopamine starts rising to help us focus on pleasurable outcomes, and testosterone rises, and the feeling of pleasure increases, and with stimulation goes to the plateau, which is basically getting more and more aroused until we reach orgasm. And orgasm is characterized for women by contraction of the pelvic floor and the uterus at about 0.8 seconds, and an intense pleasurable feeling. Afterwards, the next phase is called resolution. That's the time when oxytocin starts flowing in our brains and starts making us feel very relaxed and bonded and very comfortable. And for some women, it's a period where they may be able to enjoy another orgasm, and some women are multi-orgasmic, but not all women are. So that's the basic idea of the human sexual response. And what happens when women lose their ovaries and when they lose the ability to feel natural desire, then the work towards arousal and orgasm is a little bit more labor intensive, but it certainly is very possible. As LaShawn mentioned, and we should just say that when people experience surgery in their pelvis and part of the pelvis is removed or treatment changes the way the body works, people experience losses. So the first loss is kind of a sense of one's body image. So we all grow up with very idealized ways that we feel about our bodies, and all of a sudden we may lose familiar sensations, and that doesn't feel good. And that includes familiar sexual feelings. People begin to lose confidence. If a person is single, they begin to lose confidence as a person viable for a sexual relationship or a relationship in general. And if people are partnered, then if there is no ability to kind of have spontaneous arousal and it's more work, there's a sense that spontaneity is lost, and the familiar interactions, which were very easy to come by, are no longer so easy. So that is quite challenging. In the relationship, if you think of a relationship as kind of resting on a tripod of important factors, first of all, people make a commitment to each other, then they get to know each other very well and begin to feel emotionally close and intimate. And sexuality is kind of like the glue, third part of the glue that holds their relationship together. When people lose sexuality or their passion, even if they've been very intimate, once they stop being able to talk about sex, so it becomes a kind of an avoided subject, they begin to lose intimacy. And pretty soon they start feeling very distant from one another and lost. And that's a very hard thing to go through. So, in sex therapy, we realize that it's very important to be aware of all these three important aspects of relationship.